So in this video, we'll go over the treatment. Let's say you did get a biopsy because it was significantly enlarged or abnormal on physical exam. If it's an IgG4, remember the type of Hashimoto's that is present in younger men, and in that case, doing a short course of steroids actually helps reverse the inflammation. Selenium supplementation in various studies have shown to reduce the autoimmune state. Newer treatments are being developed. They don't know if they can use the same kind of treatments for other autoimmunity, but usually I think the bottom line is management of stresses and the immune system. So stress is known to be an important factor in Graves' thyroid disease, which we will discuss in a different article, but many studies have shown stress may be responsible or may not be responsible. It's really not clear. However, you find in the history, when you look at the story, stressors are very important. So managing stressors would be the first step. A stressor would be a nasty divorce or a loss of a spouse. Those are all big stressors. A financial loss is a big stressor. So removing stressors, for example, when feasible, like changing jobs. If a job is killing you, change the job. It's not, I know it's easier said than done, but it's one of those things that you have to make an effort because none of us like change. Decrease the disruption of stress through meditation, mild exercise, and vitamins. Good nourishment. Every cell in our body communicates with two bacterial cells. It's very important to take care of our gut bacteria. We have more bacteria than cells in our body. So take very good quality probiotics. Eat lots of fiber-rich foods. People go after paleo and keto diets. Those are not effective in the long run. They may help with weight loss intermittently or in the immediate few weeks that you make a change. But ultimately, health is really about fiber. Whole grains, lots of vegetables, some fruits. If you gotta get your gut checked to see if you have to avoid fruits. So like insulin resistance or candida overgrowth. Lots and lots of water, because every part of your body requires water. It's 99%. The molecules are water. Staying gluten-free is very important because Hashimoto's has been associated with gluten sensitivity. Sometimes fewer grains. The association of celiac disease with autoimmune thyroid is very clear. Now with Hashimoto's, gluten sensitivity is also very common. Omega-3, omega-6 balance has to be checked and replace it if you don't have a ratio of 4:1 that is more omega-3, more omega-6 than omega-3. Sorry, it should be more omega-6 than omega-3. Vitamin D is very crucial. Most people are deficient in vitamin D because of gut issues. So making sure that vitamin D levels are between 55 and 80 is important. Selenium-rich foods like Brazil nuts. Now, you also want to monitor the activities of other hormones like insulin and hemoglobin A1C. If those are not in the appropriate range, that needs to be addressed. Cortisol through salivary or urinary cortisol, if it's also disordered, can affect your thyroid functions. Estrogen or hyperestrogen state can lead to a high insulin resistant state and therefore thyroid issues. Supplements that people may benefit as a part, especially when the immune system is triggered, is vitamin A, very important for any autoimmune condition. And like I said, the comfortable level is 55 to 80. Selenium, particularly in autoimmune thyroiditis. Vitamin A. Glutathione is a biotransformation substance found in the liver, and I do prefer intravenous glutathione because it's a good detoxification agent and helps with the thyroid processing. Pancreatic enzymes, if you have a problem with absorption. Probiotics. This is very important, particularly for the gut bacteria. You want the right kind of gut bacteria making all your B vitamins and supporting your hormones.